Hey guys, my name is Alexis. I am a private practice owner and licensed mental health counselor. And I am here just to do a little personal disclosure that I hope is helpful. So recently, I had to go to the emergency room due to a decrease in my blood pressure and increase in my heart rate. And while I was there, the provider I did see maybe 4 minutes out of the 4 hours that I was there, and that is being very generous, um, gave me a very dismissive, ambiguous, lack of direction, misdiagnosis based on the evidence that I could find and that the evidence that was presented from my labs. And so I'm just really here to say, please advocate for yourself because despite my training and what I do for a living, that provider absolutely made me feel dismissed, not seen. I was making things up, or I was just simply not understanding things that I did know. For instance, dehydration. I do know what that means, and I can understand what it means not to have it. And so when someone kind of tells you that the sky is purple and they're convinced, sometimes they can convince you. I subsequently followed up with my primary care provider, who then went on to discuss with me the reasons why we were going a different route, right, than the provider I saw before. But I have seen this, and I feel like it should be a discussion with psychiatric patients under care of psychiatrists or psychiatric nurse practitioners that prescribe medication, specifically psychotropic, that when we go and see a provider of some sort in the healthcare system, I think that sometimes we need to look at it with a more critical eye, have support, feel heard, feel validated, and make you feel at ease or at least at somewhat more comfortable about what they've told you, as opposed to dismissive or as opposed to invalidating. And really just advocate for yourself because, again, I say, despite what I do for a living, I felt like I was totally being gaslit. That's my term. You're welcome. You may use it in the future. So, bottom line is, I just want to normalize and open up the discussion for feeling like you are not heard or understood or validated when you're going to see a provider who you would hope would do that for you during a health battle, during a health decision, during a health issue, what have you. I really hope this was helpful to some people. Please feel free to comment on maybe some experiences you've had. Hope this was helpful, and I look forward to seeing you next session. Bye, guys.